Neonates are what we call obligate nose
breathers.
They do not know how to breathe from their mouth. You and I, or even older children, we have a blocked nose. What do? We breathe from our mouth. Babies do not know how to do that.
Hello, everyone. It's Pediatrics to go, and I'm hosting. It's really, we see exactly. I have my cheerleaders here, Dr. Tanusi and Dr. Budashiru are here cheering me on. So today we're talking about something that is probably the commonest complaint I get clinic and out of clinic, and it's upper respiratory tract infections. I think I'll be touching on the common cold specifically, but we'll touch on the others as well. And the common cold, I always tell mothers that if your child is in creche or school, they're entitled to at least 8 episodes of a viral upper respiratory tract infection in a year, and that is at least. And this is because children interact with themselves really closely. So they can. One mother actually told me that a teacher actually told me that she saw one pupil trying to pick mucus out of the nostril of the other pupil in the generosity of her heart. Of course, I mean, she's definitely going to go home with, a respiratory tract infection. And the reality is that most viral respiratory tract infections are mild, they are self-limiting. They will go away by themselves no matter how much vitamin C you give. And so what you need to do in the time between when they develop the cold and when the cold goes is to keep them as comfortable as possible. If they've got a fever, give them some paracetamol. If their nose is blocked, find a way of actually sucking the mucus out if they can't blow out, especially if they are much younger. The reality is that upper respiratory tract infections like the common cold can be quite uncomfortable, especially for really young infants. So we're talking about children less than 1 year. Because their noses are quite small, it just takes a very little amount of mucus to make them really uncomfortable. So your friend in that situation is saline drops, okay, and a mucus extract or something to just suck the mucus out. A lot of Nigerian mothers actually use their mouths to suck the mucus out. We don't recommend that because you can catch the cold as well, and you can give them, some sort of infection. So make sure they are comfortable. If they have a fever or they are not drinking well enough, we find out that they don't have a wet diaper in about 4 hours, please make sure you take them to the hospital, because sometimes the cold can make them so uncomfortable that they refuse to feed and they refuse to drink. Or if you notice any difficulty with breathing, please go to the hospital. Dr. Mudashiru, the common cold is very common, as it implies. What is your experience with dealing with the common cold?
Well, as you said, very common. So a few points I want to make. A lot of the time you don't need antibiotics. Because even in the UK, they can't depend. No, we think she needs antibiotics. He needs
I think we talked about
this.
this.
Antibiotics.
We started.
They don't need antibiotics. Okay, it's a virus. It will go away by itself. Now, saying that, there's sometimes if a child has a comorbidity, an underlying medical condition, sometimes they have like a congenital heart disease, things like that. The common cold can progress to something more serious. It becomes like a bacterial, chest infection. Such situations, they will need antibiotics. But, the child will be quite unwell, so you will know. But the majority of the well child, still jumping around, active, eating well, no fever, whatever, even a mild pyrexia, whatever, they don't need antibiotics. It will go away by itself. Second point I wanted to touch on, which you already touched a bit on, is in the little ones. Now, especially I'm neonate, so I go with my neonates. Neonates are what we call obligate nose breathers. They do not know how to breathe from their mouth. You and I, or even older children, we have a blocked nose. What do? We breathe from our mouth. Babies do not know how to do that. I keep saying this. A baby with a cold is not a baby that you want to deal with. It can be horrible.
Yes.
Horrible. They can drop oxygen levels in their blood. They can be very unwell with it. All because the nose is blocked. They cannot breathe through their mouth. What do you do? As you said already, the saline drops can help. And these days, these are the suction devices. They're all sorts of fancy. The other day, I was prescribing one for a family friend. I went on Amazon, and the types of suction devices I saw, I'm like, it was amazing. I'm like, okay. So, so there's lots of them out there these days. And as Dr. Renner said, please don't use your mouth to do it. Please, that's not a habit you want to do. But again, the best thing to do with these little ones, try to avoid it in the first place. You have a baby, you come home, everybody wants to carry your baby. Not just no. Whoever carries your baby, first of all, minimize people that carry your baby, and they must wash their hands first. Wear a mask if possible, If they have a cold, they cannot come near your baby. But the worst culprits are the siblings. They are the culprits, the 2-year-olds, the 3-year-olds. But they just want to go and kiss the baby, you know. So you have to keep them away from the newborn. Okay, so that's that's just all.
Thank you, Dr. Mudashiru.
Yeah.
What's anything?
Okay, so I just want to add that we just came out of a pandemic, COVID, and now COVID has been downgraded to a cold. But the problem is, I mean, in the US, it's like, oh, it's a cold. If you don't have a fever, after your fever is gone, go back to school. Now, the problem is the same COVID can cause a lot of problems in younger children. So even if it's downgraded to a cold, it still has a lot
Potential.
of comorbidities that can go with it. So if anybody is sick and has a cough, if the siblings of the baby have a cold, keep them away from the baby, especially. Talking about babies. Now, for children, there's a lot of fluid that can go from the from the nose into the ears.
Yes.
So if you have a baby that has had a cold or a child who has a cold and then they wake up at 2 a.m., why is it always 2 a.m. that those ear infections come up? And the parents tell me, oh, they woke up at 2 a.m. and they couldn't sleep. They were screaming in their ears. Guess what? That means your baby's cold, which was a virus, has now gone into, has advanced and progressed into a bacterial ear infection. So take your baby to be seen in a pediatrician's office, preferably, so they can check the ears, make sure that your child gets the appropriate antibiotic, especially if there's an ear infection in those ears.
I think it's really important. And so, of course, in terms of prevention, what we say is teach your children hand washing. They're never too young to learn hand washing. Make sure that they know good cough etiquette. They are coughing into their elbows and not into the palm of their hands. They must get enough sunlight, okay, within limits of reason, because sunlight actually helps to prevent, infections by producing vitamin D. And then make sure that they are eating right. Fruits, vegetables that are rich in vitamin C, rich in vitamin A. And hopefully you should keep the cold at bay. It's 2 a.m. usually, because if a shege is not Pro Max, is that even a shege? It's always 2 a.m. So it's been Pediatrics to go, and I hope you've had fun on this episode. Till the next time, enjoy yourself.